All right. Welcome again to the Maryland State School Health Council webinar series. This is our June webinar and the last one of the 2022-2023 school year. And I am so excited to present today with our partner, Strong Schools Maryland. And again, just for everyone still rolling in, please put your name, affiliation, and school county into the chat. All right. Let's get started. Oops. All right, so my name is Joyce Chung, and I served as your fellow here at the Maryland State School Health Council this past school year. Today, I have the pleasure of presenting the blueprint for Maryland's future, focusing on school health with our wonderful partners at Strong Schools Maryland. I'll hand it off to Ria and Maddie to introduce themselves and get us started. Thanks everyone for coming.
Hi, everyone. My name is Ria Gupta. I am the Policy Research Fellow with Strong Schools Maryland.
And hi, everyone. My name is Maddie Long. I am the Policy Analyst Fellow with Strong Schools Maryland. We are so incredibly excited to be here. I just want to give a little bit of background about our organization. So Strong Schools Maryland was founded in 2017 in response to the creation of the Kirwan Commission on Innovation and Excellence in Education, which was the precursor to the Blueprint for Maryland's Future. With our small but mighty team, which you can see here, we like to take them everywhere we go, and our network of hundreds of folks across the state, we advocate, build power, and share resources with invested Maryland residents to co-create strong Maryland schools. Our vision, which you can see here, is a Maryland that leads the nation in achieving the equitable funding of public schools and empowered stakeholder engagement. We are so excited to be here today. And now I'm just going to do a little brief overview of the blueprint. So put simply, the Blueprint for Maryland's Future, also referred to as House Bill 1300, became law in the 2021 state legislative session when Governor Hogan's veto of its initial passage in 2020 was overridden. The blueprint is based largely on the recommendations of the Kirwan Commission and offers us the opportunity to build a world-class system of public schools for all students in Maryland. So why does Maryland need the blueprint? There are a lot of valid answers to this question. You may have thought of an answer, and it was probably right. But the biggest reason that I want to highlight right now is the state was in dire need of systemically increased and equitably distributed funding for public schools. The disparities and funding adequacy gaps help drive opportunity gaps and overall outcome declines for wide groups of students across the state, in particular concentrated poverty. So when large numbers of students experiencing poverty are served in one school, it really made the need clear. So you may have heard the term 5 pillars, and that is how blueprint initiatives are typically organized. You can see them listed here. I'm just going to go through them really quick. So first we have pillar 1, early childhood education, which includes publicly funded pre-kindergarten for 3- and 4-year-olds and expansion of Patty and Judy centers. Next is high quality, diverse teachers and school leaders. This includes multiple initiatives in teacher recruitment and retention, but especially including a 10% salary increase for current teachers and a starting salary of $60K for new teachers. The third pillar, it's probably the heftiest, it's a big one, is college and career readiness pathways. This pillar focuses on ensuring students are determined to be college and career ready by the 10th grade. And if students are not, it prepares plans and targeted supports for those who need it. It also expands access to college prep courses, dual enrollment, and CTE programs. Next is pillar 4, more resources for all students to succeed. And we will be going really in depth today on this pillar, as it has a lot more involvement on specific policies of school health. However, it provides increased supports and targeted investments to historically underrepresented groups, including multilingual learners and students with disabilities. And I just wanted to highlight that. And then lastly, our 5th pillar is governance and accountability, which is really just our structure on how all of this will be implemented with fidelity. It does many things, but most notably, it created the Accountability and Implementation Board, known as the AIB, which is the state entity that's solely responsible for Blueprint implementation. And before we pass to Ria for the deep dive on Pillar 4, I do just want to emphasize how interconnected each of these are. Can we get to college and career readiness without the extra resources? Can we provide extra resources without the staffing to do so? Each of them has a lot of independent policies, but really do work together to create a better system for high quality schools, which is the overall intent of the Blueprint. So now,
Okay.
yeah.
Thank you, Maddie, for that brief overview of the Blueprint. So in terms of school health, all the pillars can connect back to enhancing student health and wellness. However, there is one pillar that has direct connections to school health, and that is Pillar 4, which is named More Resources for all students to be successful. A lot of Pillar 4 initiatives focus on strengthening wraparound services through the establishment of the Maryland Consortium on Coordinated Community Supports, the development of a new funding formula based on a new measure of concentration of poverty that aims to expand community schools, and more funding allocation towards school health supports. I want to go into a little bit of detail about a few of the programs and grants I mentioned that will most likely impact a lot of the work that you do in some way. So first things I want to talk about is the Consortium on Coordinated Community Supports. And the Blueprint created this new consortium of 24 members, and the goal of this group was to create a statewide framework to expand access to comprehensive behavioral health services for all Maryland students in a holistic, non-stigmatized manner. So the consortium already has created and proposed a hub and spoke framework for community partnerships. And this model was created to not only meet statutory requirements and statewide standards, but introduce local flexibility that is based on community needs. The Coordinated Community Supports Partnership Fund, lots of words, receives $125 million annually by fiscal year 2026. Now, you might all be wondering, a request for proposals, which is an RFP, is coming very, very soon, like within the next few months, and will be available for spokes or service providers, as well as hubs that are able to deliver behavioral health and related services to students and families. As many of you are probably wondering, schools and school districts will not qualify for direct grant funding, but will be involved with local partnerships and could receive staff training and support. In addition, all the grant applicants must have a letter of support from their LEA itself. I would highly recommend joining in on one of the consortium's public meetings. They love varied perspectives and engagement from the public, and the link for their website is now in the chat. So now let's talk a little bit about concentration of poverty grant program. So this program is basically a new funding mechanism that provides more funding for schools with high concentrations of poverty to create community schools. So community schools, if you do not know, are incredible, and Maryland has the opportunity to reinvent the meaning of schools, of education, with our focus on community schools. As we all probably know, learning never happens in isolation, and community schools focus on what students in the community truly need to succeed, whether that be free meals, tutoring, mental health services, etc., before, during, and after school. Community schools promote equity and prioritize the needs and health of students and families, and effectively utilize community-based organizations and other cross-sector systems to provide services and opportunities to students and families. Currently, Maryland has over 300 community schools. So this concentration of poverty grant program provides funds to hire 2 allocated positions: a community school coordinator to implement the strategy on a school level, and a healthcare practitioner to provide in-school healthcare and support to students and families. For fiscal year 2022, the state distributed $248,833 to each county board for each eligible community school to hire these 2 positions. While districts may set the salary for these 2 positions, any remaining funds have to be spent on wraparound services like extended learning time, school-based health centers, vision care, etc. Schools considered having a concentration of poverty receive both the personnel grant I just talked about and additional per pupil funding. Eligibility for the grants is dependent on the percentage of students in your schools receiving free or reduced meals. So the eligible percentage decreases every fiscal year. So in 2020, the grant was awarded to schools with 80% or more of students receiving free or reduced meals. Now, currently, it is awarded to students with 65% or more students receiving free or reduced meals. That eligibility is a sliding scale that will decrease to 55% by fiscal year 2025. Finally, I want to briefly touch on school-based health centers. As you probably know, many services are provided at school-based health centers to support student attendance, school engagement, and achievement. These services include primary medical care, mental and behavioral health care, dental care, nutrition education, and many others. Currently, we only have around 95 school-based health centers in Maryland. So to address this issue of low availability to these service centers, the Blueprint increases annual funding for school-based health centers to $9 million. Additionally, under the Blueprint, the behavioral health coordinator and the local school system have required planning that must allow all students some exposure and access to behavioral health programming and services. And they also must have a plan in place to connect all students to community-based services if there's not a school-based health center in their school. So that was just our brief deep dive into Pillar 4, and I hope you found that informative. I want to change gears just a bit and talk to you about some of the work Strong Schools Maryland has been doing, but also I understand that we're taking a turn. So if you have any questions, and you might forget them, please put them in the chat. We will address them at the end, but please put them in the chat while you have them in your mind right now. So the first project I want to talk to you about is our progress reports. So in the beginning of January 2023, our team conducted a deep dive into Blueprint mandated reports. Counties, if you know, are required to submit certain reports every year to update MSDE, the AIB, and the public on their progress with Blueprint implementation. So while there were a lot of reports submitted in 2022, Strong Schools analyzed a sample of reports, including diverse hiring practices report and the 2021 and 2022 trauma and behavioral health report. So our analysis was pretty simple. It just asked the question, did the counties provide responses to the reporting questions posed by the law? So every report had outlined guidelines with questions the county was supposed to answer. If a county did not meet all the parts of the given requirement, they were given a rating of needs improvement. So as you can see by this map on your screen, a majority of the reports submitted did not meet the minimum required noted by the law. There were a few counties, however, that submitted satisfactory or outstanding reports. So with these progress reports, we aim to simply emphasize the importance of high quality reporting and how it's essential to the implementation of the Blueprint. I specifically bring up the progress reports right now because two of the reports we looked at were the trauma and behavioral health reports. Based on what I heard from one of the regional meetings is that a lot of you don't have a connection with your local Blueprint implementation coordinator, who are the people who wrote these reports. I think the overall quality of these reports emphasizes how important it is for collaboration between you and your local Blueprint implementation coordinator. With your expertise of the local health happenings in the school environment and their expertise in the Blueprint, reporting has the possibility of being phenomenal. Now, I just want to hand it off to Maddie to talk to you about local implementation plans.
So on March 15th of this year, implementation plans by every LEA and state entities like MSDE and the Consortium on Coordinated Community Supports were submitted. First, I want to walk you through where you can find these in the first place on the AIB website. So we have a link in the chat that should be coming up. This is the AIB website, and in the top right corner, you're going to click Implementation Plans. Then you will scroll down a bit to click Local Education Agency, LEA Plans. And then you will search for your county and the counties you're interested in to access their plan, and it will take you right to a Google Drive link. These plans include the LEA's planning and implementation work that began in 2021 and ends with plans for the 2023 through 2024 school year, which also includes LEA's plan for Pillar 4 and their plan on how they plan to expand things like behavioral health services. As Rhea kind of mentioned, we heard at regional meetings, we have an understanding that many of you were not aware that these plans were made, let alone did you have any input on them. I really want to note that in these plans, at the end of each pillar section, according to the criteria for success that LEAs used to develop these plans, there should be a list of who had input into developing the plans for each pillar and the overall plan as a whole. So if you were involved or believe that you should have been, that is a really great place to start. We are actually going to take a little bit of a break now to pull up your county's plan and search for the Pillar 4 section where they list who had input into developing the plans. Once you do that, I would love if you could indicate with emojis in the chat whether you are satisfied with the list of stakeholders they engaged with to make the plan for Pillar 4, or if you did not. We could just get a thumbs up or a thumbs down, and we'll take about, what, Rhea, 5 minutes, 3 minutes?
Yeah, 3 to 5 minutes. Let us know if you have any trouble finding your plans, finding where the stakeholders are listed. We can go back and guide you through. I put mine in already because I already looked at my stakeholders.
Did you do Baltimore City?
Yeah, Baltimore City.
Okay. I've looked at a lot of plans, everyone, so I don't know which one I would choose. Probably most of them are this though.
Would anyone want me to pull up their plans while they're pulling it up? Anyone want me to shine a light on their county specifically? Yeah, we can look at Baltimore.
Yeah, Montgomery County would be helpful. I finally found it on page 170.
Yeah, these plans are long. Sometimes in the table of contents, you can find it and click and it'll take you there. And then other times in some of the other plans, they don't do that. I don't know why. I wish all of them did that. That would be very helpful.
So this up here is Montgomery for those who are interested. So it looks like they worked with parents, teachers, principals and staff, working with EL students.
Yep. School health services is missing,
Yep.
just saying.
Let's look at Baltimore County, like someone said. Yeah, these documents take a little bit to load, but I'm guessing that we're going to see a few themes throughout the lack of. This is Baltimore County's. So no school health, well, kind of school, not really school health at all. Anybody else have any thoughts on their plan and the stakeholder engagement? I see a lot of thumbs down, thumbs downs in the chat. Rebecca, where are you from?
Garrett
And
County,
yes,
and I was part of the planning process in Pillar 4.
okay. That's beautiful. We love that.
Yeah, just went to the Community Schools National Community School Conference with my director and the people from our new community school. So we're collaborating.
I love that. I'm jealous. I wanted to go to that so bad. I just couldn't make it happen. But that's
It was really good.
I heard the group from Maryland was huge.
Yeah, it was. We had breakout lunches with each state, and it was huge.
That's fantastic. Okay, I hope everyone was able to find their plan, and if not, feel free to send us a direct message. We can help you find it. I hope that was helpful for some of you to figure out who has input on things. So currently, MSDE and the AIB are reviewing these plans in a fairly short time frame. So they are still in the feedback phase and are not technically approved yet. We're looking at more of a July timeline for that. So that means that there is still time to have input into your plans if you want. There are 3 ways that you can do this that we're going to outline for you today. So first, the AIB has an open forum on its website in which any member of the public can provide feedback on any of the plans, including all of the local ones and all of the state entity plans. A link for that should be in the chat. Thanks, Ria. So second is working with us at Strong Schools. We created a simplified worksheet that helps make the plans a bit more manageable and specifically look at areas with challenges and strategies to overcome them within implementation. The worksheet looks at pieces from all 5 pillars, but if you are only interested in certain pillars, that is totally okay. We have some people working with us who are only looking at pillar 1 right now. Here is the link for that. It should be in the chat. Then all of the instructions are in there if you're interested, and please feel free to reach out to us with any questions that you may have. And then third and finally, we really encourage you to connect with your Blueprint implementation coordinator. Invite them to your local school health council. You are a very important part of their work and vice versa. These plans are not one and done. We will see iterations of them over the course of implementation. So it's really important that every stakeholder has a voice in implementation. MSDE has a list of all Blueprint coordinators and their contact information. And so please let us know if we can support you in any way in your outreach. And the link for that should also be in the chat. Thank you, Ria. So that is all from us for now. I will pass it to Joyce.
Thank you so much, Maddie. Appreciate it. Let me see if I can get these slides to work. Nice. All right. Yeah, thank you so much, Ria and Maddie. We really appreciate you guys. So continuing on, now that you know how to contact your blueprint coordinators, how to reach your LEAs and get involved, next step is when you're actually blueprint planning and advocating for school health, what we've learned anecdotally from all of you in our state school health council community is that it's sometimes hard to know how to exactly generate ideas and take concrete steps to support school health. It can be a little bit overwhelming. So we at the Maryland State School Health Council have been holding discussions with counties around Maryland at our regional meetings to gather ideas and practices that counties currently use to support school health. So today we will be presenting everything that we found from other counties around Maryland and how they are leveraging the blueprint to support school health, and in particular, targeting the blueprint's fourth pillar of providing more resources for all students to be successful. So to frame this discussion today, we will be using the whole school, whole community, whole child, other ways known as WISC model, as developed in 2015 by the CDC and ASCD. And this is going to be our framework for understanding how to support school health with the newly passed legislation. So we will go through each of the 10 components of the WISC model and all the ideas compiled that we collected from all the counties in Maryland. And so bringing it back to the blueprint, although all 5 pillars of the blueprint will inevitably impact school health, we will be choosing to focus the discussion around pillar 4, more resources for all students to be successful, which Ria and Maddie kindly discussed for us earlier. So let's get into it. So the first component of the WISC model is health education. And how that relates to the 4th blueprint pillar is some ways that counties around Maryland have been working to meet the needs of all students to support health education. And some of the ideas that have come up are tailoring health education lessons for struggling learners, ELL students, and special education students by providing visual or audio supports, holding evidence-based health education trainings and compensating for the additional planning time for educators, partnering with your local SNAP Ed to provide curriculum support on nutrition topics, expanding certified health education to the elementary school level. Moving on to the second component of physical education and physical activity, counties have suggested improving equipment to include non-traditional and accessible PE equipment, incorporating adaptive PE, so like imagery, audio support, or alternatives like hiring additional staff that are trained to assess individual students and provide individualized supports, offering transportation support after school, physical activities, and athletics to support students that may have limited transportation, holding awards, scholarships, and incentives for students and families participating in physical activities to support student physical education and activity engagement. Next component of the WISC model is nutrition, environment, and services. Some ways that counties around Maryland have been providing more nutrition, environment, and services support for students include provision of dinner with extended school days, offering summer lunch and learn opportunities, teaching healthy cooking as an after-school summer program or a virtual webinar, hiring a dedicated dietitian for their school, supporting a student food pantry, so like a refrigerator or just a cabinet with snacks for students to take throughout the day, and providing allergen training for all staff. Next component is health services, and some ways that counties around Maryland have been bolstering health services include providing access to health services during extended hours, partnering with community services to prevent duplication of services, strengthening communication around referral systems to other health entities around the county, conducting needs assessments for health services in schools, just so you can better understand what the needs of the student population are and tailoring your support accordingly. Next is counseling, psychological, and social services. So in this component, counties around Maryland have been utilizing tools and digital tools that provide virtual learning modules for mental health support, hiring on-site social workers, hiring a dedicated behavioral assessment staff member. So this staff member would track student progress, offer professional development for staff, and provide other trainings and services. Next component is social emotional climate. And in this component, counties around Maryland had a lot of great ideas like offering sustainable restorative practices, de-escalation, and trusted adult trainings for school staff and teachers, providing mindfulness and de-escalation rooms and carts, even like Zen carts that can be moved from room to room, or one school mentioned having a Zen hallway for elementary school students to pass through between classes. Other ideas include hiring staffing to support these mindfulness and de-escalation rooms, and finally conducting screeners to better identify student population needs. Next, we have physical environment. So in this component, counties around Maryland have had some great ideas like creating student gardens and increasing green space and green space exposure for students. And this is well known to decrease stress and improve mental health. Other considerations like ensuring dedicated spaces for the school-based health centers and special health equipment might be more helpful in the planning and development of new schools. But it could just be something to keep in mind if that's applicable to you and your county. Next is employee wellness. This component in particular started a lot of great conversation at our regional meeting about how to support staff. And we all know that supporting the teaching staff is definitely one of the best ways to also support your students. So some ways counties around Maryland supported employee wellness was to provide information and communication about resources that are provided by health insurance coverage, and just kind of like making this information more accessible to teachers, providing incentives for staff wellness, for example, for like wellness challenges and exercise challenges, just using the money to provide more fun incentives, extending healthy meals to staff, connecting with your local SNAP Ed to provide employee wellness support, holding space for support groups like for staff for health topics like the student opioid use epidemic, mental health, and trauma support. And last but not least, our two components of the WISP model are family engagement and community involvement. And one of the best ways to support school health is really to reach students on all levels, like their surrounding community and their families. So counties around Maryland have suggested holding wellness fairs partnered with the local health department and community organizations, holding flu shot and vaccine clinics at schools, hiring a dedicated staff member specifically responsible for community engagement and outreach, engaging students in local health roundtables and including youth advisory councils and planning, prioritizing language diversity, inclusivity, and multiple communication methods in programming. So that concludes our WISC model. And in summary, what we have gathered from our regional meetings is basically school health is largely missing from the conversation in terms of planning for the blueprint. Of all of the local school health councils in Maryland, only 18% of local school health councils have their blueprint coordinators like at the table and participating in the conversation around school health. As you can see here in this chart, it's great that we have so many people involved, but we really want to include the blueprint coordinator and reach out to them so that they can hear all of your great ideas and experiences. And it was also very clear from our regional meetings that local school health councils have the potential for having a huge impact in terms of providing wellness guidance and impacting wellness policies and practices. As seen here, local school health councils are already making a huge difference, with 64% helping to revise their district's local wellness policies, and 60% providing guidance to schools on wellness policies. So by getting involved with the blueprint, getting involved with our partners at Strong Schools Maryland, submitting feedback directly to the state, and the potential to really leverage the blueprint to support and advocate for school health is huge. So with that, I'd really like to turn it back to our wonderful partners at Strong Schools Maryland to provide just a few more resources on how to do just that before we leave today.
Thank you, Joyce. And just echoing what she said, there is so much potential here. So we really encourage you, if you've loved what you've heard today, to get involved with us. If you are interested in getting involved with Strong Schools and some of the work we do in blueprint implementation specifically, here is a QR code with contact information for our amazing organizers, Maya and Jamal. You can set up a meeting, have a conversation, and they will be able to set you on track with the best ways to engage with us. We are very active at community events like tabling and providing information on the blueprint. We also do a lot of advocacy at the state level, which actually leads me to pass it to Ria to talk more about that.
Yeah, so thanks, Maddie, for that. So one exciting point to make is that Strong Schools Maryland is going on tour this summer. So that what that means is we're going to be hosting a bunch of events like cookouts and policy discussions throughout the state this summer. Dates and locations are still to be decided. We are coming to Frederick County on July 8th for sure. But we would love to see you there. We would just love to see you when we come visit your area. So to stay in the loop about events like the tour and other things Strong Schools is up to, please follow us on social media. We have an Instagram, Facebook, and Twitter. We would love for you to follow, tag, interact with us on any of those platforms. And lastly, I'd love if you could sign up for our newsletter. There's a QR code so you can receive periodic updates about the blueprint and our work that might be impacting you. So again, we want to thank the Maryland State School Health Council and just allowing us to talk and allowing us a space. And I'm going to pass it back to Joyce to deal with the questions.
Thank you so much, Ria and Maddie. So yeah, we'd like to open up the floor for any discussion, questions, or comments that you may have about the blueprint. Or checking the chat, or feel free to just shout it out.
Will you be sharing the slides? Because some of the resources I couldn't quite get.
Yeah, for sure. So I will be sending out an email after this webinar with the slides, and then we'll post the recording of this onto our website as well.
All right, thank you very much.
Yeah, thank you.
Joyce, this is Erin. I could ask a question if while others are thinking about their questions. And my question is both for Strong Schools Maryland and for some of our partner agencies that are on the call. Most of the content was really directed towards local school health councils or local school systems. Is there a space for like Shape Maryland? I see SNAP Ed and some of our other partners to get involved in this work. And to those partners who are on the call, have you started getting involved in blueprint conversations and having a seat at the table? So whoever wants to go first.
Sorry, I was trying to unmute, but Joyce and I are sharing a mouse right now, so it was going all over the place for a second. So trying to unmute. But yes, there are a lot of opportunities for any program to get involved. Every organization that's surrounding school health is involved with this, and that is clear. This is not just a LEA's movement, because this is not just an MSBE. This is not just an AIB. It's like all of us need to come together and bring all our resources together. I think one thing I mentioned, this might not be so related to like things like SNAP Ed, but SNAP Ed is really important. But like for pre-K expansion, we were talking about, sorry, my brain. The consortium is making hubs and spokes for community partners that can deliver behavioral health services. So any local organization that supports those services should get involved. There's a lot of money on the line and a lot of children that could possibly receive help through those services. But basically there's a space for all these organizations, and we would love to connect with those specific organizations to find that piece that in the puzzle, the big puzzle, that to find them a place for that. Yeah.
I see a question in the chat from Rachel. The answer or the question is, will the LEA implementation plans continue to be updated by LEAs? Yes. The current iterations actually are in the process of being updated. There was a little bit of miscommunication between the AIB and MSDE. I don't know if you've seen it on the news and in papers and stuff, but they received some feedback from MSDE. They have not received their feedback from the AIB yet. So it's coming. Multiple iterations are supposed to be coming. They're all supposed to be posted online. We'll see if that happens. We've requested that from the AIB, but we should be able to see measurable changes. Hopeful. Thank you for the question.
And then for like the blueprint goes on for almost like for a while longer. So there will be other iterations of the implementation plan. I think the next one is due next year, exactly like around this time. And then maybe a few years later, there'll be another iteration of the plans.
All right, I'm just gonna hold the space open for a few more minutes if anyone has any more last minute questions. Otherwise, please feel free to contact myself at the Maryland State School Health Council or Bria and Maddie at Strong Schools Maryland with any questions you might have. I will email out their contact information and resources for anything you might need following this webinar. Otherwise, thank you so much again to Ria and Maddie for joining us at our webinar today. And thanks to you so much to all of you for joining in on our final webinar of the 2022-2023 school year. We're really excited to see you again in the fall, and I hope that everyone has a great summer.
And I want to also thank Joyce, because this is her last webinar as our fellow. So thank you to Joyce for all of her hard work this whole year and for ending the school year in a great way with this fantastic webinar. So thank you, Joyce, for everything. Sorry to jump in. I just wanted to give you the applause you deserve. So
That's
thank
so
you all.
sweet. Thanks, Dr. Hager. Thanks, everyone.
Thank you. Have a great summer, everyone. Take care.